we are actually coming to almost tail end of the winter, which is the time where you see a lot of viral infections, cough, breathlessness, and allergic problems. They are almost going to come up now, mid-February, starting early March. We have a lot of air pollution also. Then there are pollen coming in the circulation, dust mites, and all these are irritants in addition to the chemical pollutants that we have. And all of that adversely affects the lungs, and causing more cough and more respiratory distress. So we are seeing a lot of patients with cough and colds, and some of them having the respiratory distress, where the breathing is very fast. And, during the night, you have a lot of coughing. And some of the patients who are breathing very fast and having trouble breathing are getting emergency visits. What's more important for the parent is to look at not within the first day or two of fever that you have to run to the doctor. Just give it few days. If there is respiratory distress, running nose, breathing distress that is happening, and constant coughing, and it first starts more during the night time. And if it's during the night time, then one should get the attention. But otherwise, having a humidifier at home may help, but the air purifiers don't really help. But if you have a known asthmatic condition and you have a nebulization at home, then that nebulization should be tried first. I think steam inhalation and gargles are very useful things, and they should be used. And sometimes it's only at level of that treatment you may be able to avoid hospitalization. The child who has been coughing, just look at the nostrils. If there is a nasal flaring that is happening, if there are neck muscles, and if the breathing rate itself is going to as high as 45 to 60 per minute, I think that's a red flag. If there is any color change in the nails or the tongue, or the skin looking blue, one should not be waiting for the respiratory distress to deteriorate so much. But before that, if the respiratory rate is high, and very small children, first quit eating. If the child is not willing to eat, not willing to drink, will keep nothing down, is throwing up, having coughing, those are the red flags, then one should seek the attention of the pediatrician.